So before we begin this discussion, I would like to thank each and every one of you for taking the time to attend this online massage ethics class. This tells me that you respect your profession enough to continue learning how to improve yourself, educate yourself and your clients, and to learn how to run your business in an ethical manner. I also would like to thank Gwen for joining me, because without Gwen, I would be talking to myself.
I'm not gonna let you do that.
No, thank you. I would also like to clarify that as licensed massage therapists, we are being held on a higher standard. For those joining us who are not licensed massage therapists and are certified massage attendants, it is my hope that you can see how important education, or educating yourself and your clients in the proper way of conducting yourself, is important for the massage industry as a whole. Without being accountable for your actions or inactions, you may be hurting yourself, your clients, your colleagues, or your business. By behaving ethically, massage therapists are acting as responsible role models who help build public trust and establish a standard of expectations for a professional therapeutic massage. Ethical conduct also helps provide consistency in the professional behavior of massage therapists, thus maintaining the integrity of the profession as a whole. So now, before we can begin an assessment of your professional ethics, it is important to define what ethics actually are. At its simplest, ethics is a system of moral principles. Ethics is also concerned with what is good for the individual, the society, and is also described as moral philosophy. The term comes from the Greek word ethos, which can mean custom, habit, character, or disposition. An ethical massage therapist maintains the highest standard of the profession. This means that you uphold the physical, emotional, and mental well-being of clients and others working with you, as well as yourself. By maintaining these standards, the massage therapist will attract even more clients for their services. Isn't that right?
That is correct.
And for the 22 years I have been in business, I have lost and gained people through my ethical decisions. I've made bad decisions, I've made good decisions, and there are decisions that you kind of don't know if it's good or bad because it's in the gray area, and we'll talk about more on that. We both, Gwen and I will both be talking through our experiences and some of the experiences of our colleagues that we know of. So now, being a professional in your industry, in our industry, means staying up to date on continuing education. So that's basically what, are we on professionalism now?
Yes.
Yeah, professionalism, okay. So the continuing education requirements, being mindful of our therapeutic relationship with patients, perform care in an ethical manner, and generally be a good therapist. Professionalism, some believe, is less about what we require externally from those entering the profession and more about what we evoke within their hearts. The commercialism of what we offer needs to be balanced by the spirit of service, collegiality, pride, independence, leadership, and integrity. Now, integrity is really, really big, and that's why it's last. Commitment is much easier to inspire by offering a challenging example that it is to force by rules and regulations. So now, who can tell me what a professional LMT should look like? So when you were starting, Gwen, in school, what did you think a professional LMT should look like?
Almost like a like a physical, like almost like a nurse,
Ah,
only just dressed differently. That was my thought prior to going into school.
okay.
You know, they had a certain dress code, they had a certain look. You know, they had a look of their business, which was healthcare.
I didn't know exactly what to think of massage therapists other than most likely had a uniform. Um, I thought at first it was scrubs, but it wasn't as comfortable as I thought it would be, and it looks too much hospital, clinical.
Hmm.
And
Hmm.
so I decided not to have scrubs because it just looks like you're in a hospital, and I don't want people to think uh, they're entering a place in which it's too sanitized.
Right, too medical.
Correct. And then on the other hand, I didn't want it to be spa-like, too dark, too dingy, um, and too catering or pampering. I didn't like the idea of pampering way too many clients to a point that they become spoiled clients. I don't
Yes.
know. That was me. So that's why I turned into medical, the best of both worlds.
And it is.
So the next one here, did it just do that or did it just, interesting. The legal and ethical requirements. So here in the United States, we are all required to follow all applicable laws regarding the profession, including local and national. And each massage therapist will need to make sure you are up to date on any changes on the laws that govern your profession. In the Philippines, I don't know all the laws that is governing uh, massage therapists, but all I know is there is a miscommunication. There is a uh, some corruption involved because as an outsider, I learned in 2010 they created a mandate. I thought to create this licensed massage therapist in which they have to go through the Department of Health, and that only those who are LMTs are the one that should go out of the country to do massage therapy work. Unfortunately, there are certified massage therapists who are not licensed, who did not go through the sanitation and the proper channels of how to do the massages. They probably learned the techniques, but not necessarily anatomy, physiology, and kinesiology, pathology, all that stuff that we've learned in our school here in the United States, which is very closely like a physical therapist or an acupuncturist. So you have to know the body, the anatomy of the body before you touch it. My understanding is they didn't go through that, and so, but unfortunately, there's way too many certified uh, massage therapists who are actually going out of the country of the Philippines, and because the other countries don't know any better, are accepting that certificate. So my thing is that why create a law in which there's still chaos? And they made more of a chaos than anything because there's no um, clarification. And what I'm also not understanding is they created this licensed massage therapy that they've abandoned during the pandemic. And I am not happy with that. If you create it, you got to take care of it. It's like having a baby. You got to take care of the baby. This baby is only 10 years old and they're not taking care of it. It's like you're on your own. And so this is the reason why I'm doing some of these free right now, but next year it's not going to be free. Um, Videos and online courses so that I'm kind of hoping that it'll give people a little bit of a chance, fighting chance to when they get back to work, they know what some of the things that I know and that they haven't learned from anyone else in the Philippines. It's very difficult to get new ideas when people from outside the Philippines um, are not able to come in. And also the requirements in the Philippines are so basic that to teach them, you have to start from the base. So stuff that you and I learn in RTC, we're talking like first trimester.
Okay.
And most of the people who are actually doing the massages are now in second trimester, but getting paid.
Okay.
So that's how my take on it. Some are actually on third trimester. They're the one that's actually starting to see other ways to get their modalities from YouTube, from books, from all that stuff, trying to teach themselves. So again, on this law, legal and ethical requirements, whatever it is that is supposedly ethically needed as far as law is concerned in the Philippines, you must abide by it. And unfortunately, the ones who are not abiding by it are not the ones who are licensed.
We just hope it doesn't catch up with them.
I know, which kind of hurts me because I really want to help the LMTs in the Philippines. All right, so confidentiality. Here's a big one in the Philippines. You know, it is a massage therapist's obligation to keep information shared by a client confidential, meaning secret. You don't tell everybody, no chismis, okay? Spreading this information may not only damage the client's reputation, but does not demonstrate a reputable or ethical way to run a business. Confidentiality is an essential part of the code of ethics. None of us would want to deliberately embarrass or harm a client, but sometimes we may not be aware of the finer points of respecting clients' confidentiality. Here are two challenging ethical situations to test your knowledge. So, all right, here we go. So here's the first scenario. Okay, you have a client named Sally, who is also your friend, tells you during a session that she is 3 months pregnant. She mentions several people in your mutual circles, who knows her good news, and she doesn't tell you, it's a secret. Soon after, Martha, who is a friend of Sally's, comes for a session and complains that Sally has seemed preoccupied and unavailable lately. Thinking you're doing Sally a favor by explaining, you say, that makes sense. After all, she's pregnant. Later, an outraged Sally calls. I specifically didn't want Martha to know that I'm pregnant yet. She is so negative, so pessimistic, and I wanted to be further along in my pregnancy before I told her. I assumed that what I told you in a session would be private. Does she have a right to be angry? After all, you were only trying to be helpful. So what do you think? Was the therapist being helpful, or does the client have a right to be angry?
The client definitely has a right to be angry when you're looking from a ethical standpoint. What is said in that session stays in that session. And she trusts you with that information. And it's not even your concern to hold on to what's said in that session from the client. It's an emotional state. They're in a massage state, and when they leave the room, they may not even think twice about that they mentioned it. And you too should let go of that. There's no benefit for you.
Yeah, and plus, nobody knows what's going on between Sally and Martha, or Sally and whoever. And being pregnant is a very, very personal thing. You do not want to share anything with anybody, even sometimes the husband or the boyfriend.
Right.
Because who knows, they might not want to tell that person, because we don't know if they were cheating on somebody or that person, or or, whatever. We don't know their situation. So do not assume you're doing them a favor by telling a private conversation to someone outside that room.
No, you don't want that responsibility.
Exactly. So confidentiality is a big thing. As I said, walang chismis dahil kung magchichismis ka, you're no better than the other people who does chismis. So next scenario. Let's see here if I can make this work. There we go. So here's the second scenario about confidentiality. You've been going to your regular client's home, giving a massage to the wife and then the husband. Last week, the husband caressed your legs during session. You told him you were no longer comfortable working with him, but you would continue to work with his wife. When you returned the following week, the husband was nowhere to be found. However, the wife is curious why her husband stopped wanting a massage suddenly. I don't understand why he quit, she comments to you. He seems to be enjoying it so much. What do you say? All right.
You don't say anything. You don't contribute to that conversation.
What if
It's
that client actually kind of, so, says, do you know anything? To play
and
dumb?
your answer is going to have to be no, I do not, and try to steer her back to the session you're going to have with her. You know, I don't see any good coming out of contributing to that conversation on your part.
Well, here's the thing with me. Even though I go to people's homes, I don't do it very often. If, say, for instance, there are several people wanting to get a massage in the same household, I usually put them on the how do you call it, on the schedule. I don't just say I'm going to so and so's home and hopefully I do a massage. Um, you know, all of them. I basically want to know how many people I am massaging because I might have something going on afterwards.
Correct.
So my thing would be if say, so what do you say when it says, well, he seemed to enjoy so much. Yeah, I think he did. And unfortunately, he never said that he wanted to get a massage today. And I do have other things I needed to do.
Hmm.
So
Yeah, he
that's
didn't
the only thing.
schedule.
Yeah, he didn't schedule. But then again, you did say that you don't feel comfortable working with him. So, but I will just play kind of dumb, and that is between the wife and the husband to discuss, not me to be the third party.
Right. Right. That will, yeah, that third party will not benefit.
Yeah,
And you go about that one wrong and you'll lose both of them.
exactly. Exactly. You don't necessarily want to lie. I would just say play dumb.
Yeah,
I don't know
like
what's going on, or
no,
just
he
say,
didn't. Yeah, he didn't schedule today. I'm not sure. But I am
right?
here for
Exactly.
you.
Not
So what
sure.
are we going to do? Yes.
Exactly. All right. So moving on, this is basically the picture of what has happened on that second scenario, in which when a massage therapist will be very close to the upper body, and if the client's arms are dangling off the table, they have an access to caressing the therapist's leg. And that is a big no-no because that is very sensual. It's a one-way thing. We're the massage therapist massaging this person, not benefiting from that massage and having them touch you. They're not
Right.
supposed to touch you. And if you have any client that does that, please talk to them. We'll be talking about boundaries in a moment. You need to talk to them and basically say, I don't feel comfortable. This is what needs to happen. If you do this again, if you want to give them a second try, a second chance, if this happens again, I will have to report you to my manager or something, and so on and so forth. Um, or you can just say, I don't feel comfortable, just like what that other person said on the second scenario. I don't feel comfortable working with you. um, but I'll work on somebody else, or your wife, whatever, and so on and so forth.
It's all about trust.
Mm-hmm. All right. So, business practice. An ethical massage therapist maintains the highest standards of the profession. This means that you uphold the physical, emotional, and mental well-being of clients, others working with you, and yourself. By maintaining these standards, the massage therapist will draw even more clients for their services. As a professional, you must practice with honesty, integrity, and lawfulness in the business of therapeutic massage and bodywork. You are a representative of the industry, and that's the biggest thing. As an LMT, you represent the whole massage industry. If you have clients that see you as being fraudulent, they might think all massage therapists are fraudulent. I've
Mhm.
actually had clients come into my office and thought that everybody always used their elbows on them because that was what they perceive what massage therapists do, and that's also what they experience. Everything hurts. And I told them, no, it doesn't have to hurt. You can tell me if it's too much so I can back off. You have control. And they didn't know that.
Right.
So I had to educate my clients, and then they kept coming back because they knew they don't need to be in pain. Massage is not supposed to be painful.
It's communicating. Just keep talking to them.
Correct. So here's a bad business practice example. All right. So Crystal was planning on going out for the weekend. So she booked, she was not. She wanted to stay and work. So she booked several new and established clients during the weekend. As she was about to leave the office, she receives a text from a friend inviting her to join a small group of them to a once in a lifetime adventure. She got so excited that she started packing without calling her clients to reschedule. Instead, she canceled all her weekend massage appointments by texting each client. This was not the first time this has happened. Now, if you were one of the clients receiving a text cancellation without being offered a chance to reschedule, would you book with Crystal in the future? So as a client, Gwen, would you book with that person again?
Probably not, especially if this is not the first time they've done that, because you've got a life and you have scheduled her and this massage into your life. You're trusting her and her professionalism, and she's definitely not demonstrating that.
Yeah, and another thing with her, she's also exhibiting what most people think massage therapists are, flaky.
Yes.
So if you do that to your client, they might think all massage therapists are flaky. And when they come to Century Massage, we're not flaky. That it's like, oh wow, we have to be on time. Because if they're not on time, they're not going to get the full massage.
Right. And if we can't, we're going to call them. You know, we're going to, I mean, even if they're en route, we're trying to call them before they get to the office, and willing to speak with them when they get there, and apologizing for the inconvenience.
Well, this is also the reason why Century Massage has a front desk person in order for us to call. If she's there, she's usually there half an hour before a massage therapist comes in, or at least the first massage appointment. And then we tell her, hey, we won't be able to do this, or we'll be 5 minutes late. Could you tell the clients that we'll be 5 minutes late? Even 5 minutes late, we have to tell the client just in case they came in before us.
Right.
Because
No,
it's not professional to let them wait.
I do not want to walk into the office and the client is there and I'm late. That, to me, that is just not a good look and a good feeling.
Exactly. And so this is bad business practices. You're late for your appointment when they're the one paying you for the time and you're late. Now, if it's the opposite, the client is late, you might need to talk to them if this becomes a problem, because that will make you late for your next appointment.
Right.
And that's unprofessional on the next appointment.
It,
So,
it is. It's an ongoing event that you can't work your way out of. So, yeah, no, I'm very good at I pref, I refuse to be late. I can't put myself in that position.
all right. So the next one, here's a second example. Sam, this is kind of long.
Okay.
Sam, a longtime client of yours, is also a friend of the family. He has a habit of not showing up for his appointments in the past 2 years, and you have been working with him since then. So, since he is a friend of the family, you are okay with this and have let this go. You've never talked to him about this problem, but because we are in the middle of a pandemic, you decide to give Sam's appointment to a walk-in client willing to receive a 2-hour session for relaxation. 15 minutes into the session of the new client, Sam arrives late for his scheduled appointment and finds the door locked and starts knocking loudly at the door. You interrupt your session with this new client to tell Sam that you are in with a new customer. Sam tells you that he is not happy with what happens, so the two of you starts yelling for the next 5 minutes. You then find your new client dressed and ready to leave, unhappy with what just happened. Instead of getting a relaxing 2-hour session, their massage was interrupted and was heard and heard everything that was said. Now, what changes would you have done to have this scenario have a positive outcome?
Number one, once you rebooked someone else, you put a call in Sam to you would have told Sam so that when if and when he arrived, you wouldn't go through that uh commotion. Um
Well,
and then
yeah,
you're
texting
also
them would have
before
been nice too.
yeah, and before you leave the room with with that client that you had in session, you have explained to that client why you were leaving the room and that you would be right back and for them to stay in place because you that's all the more reason why you need to secure the client on the table.
Well,
I can
see,
yeah, I can totally understand how that client would feel.
well, this new client probably heard like, "Hey, this is my appointment. Why did you not cancel? Why did you have somebody else take over?" And then the therapist would probably say, "Well, yours is only an hour and you're late anyway, and it's 2 hours. I'm making more money with this guy."
Yes, yes,
So what does that sound like to a new client? Goes, "Wow, I'm just money to this guy and
right.
didn't even take care of me and yell everything for them to hear what's going on." My thing is, I would have, uh, because of Sam being late half of the time, I would actually text him and say, "Hey, Sam, I have a new client. They're asking for 2 hours. I've waited. I have a feeling you're not showing up because you're late, and I'm going to start the appointment now. Please do not knock on the door." Or, and then at the same time, I would put something else outside the door and says, massage in session.
Right.
Um,
Not that I think
call,
that would have
yeah,
detoured Sam because he should have stopped Sam and his behavior way before this.
correct. I would have done it way before as well. And another thing is that if he did still knock and made a commotion, I would say, "Excuse me, this will take a short while. I mean, it'll take just a moment to let the person know to reschedule."
Right.
Because, and then come back not even a minute more and begin the massage. 5 minutes is way too long to be waiting and hearing screaming and yelling. And it's not a conducive way to have a relaxation massage if people are angry.
Right. And especially if that's a new client, you know.
Exactly. Exactly. So boundaries, roles and boundaries. So now here's the role. The role is, as a massage therapist, you have power. And as a client, they have what, it's not that they have no power, they do have power, but there's a dynamic. You know, they came here for your uh, professional, um, how do you call it, knowledge for a problem that they have. And you, as a therapist, will say, okay, I see your problem, I see your condition. Let me see if I can create a treatment that can help you.
Right.
And that is the client therapist relationship. The problem with some massage therapists is they lose track of boundaries. So as a massage therapist, the idea of boundaries is not new. You understand you have ethical obligations both to yourself and your clients that govern your work in massage therapy. There are boundaries and ethical lines you cannot cross, of course, and there are still others that may change over time. Four common boundary areas in massage therapy include physical, emotional, professional, and social. These areas often overlap and influence one another. For one, having a clear picture of your personal and professional boundaries keeps you moving in the right direction because you're not spending your time worrying if you're doing the right thing or not. And that's very important to have your clear boundaries. Without clear boundaries, you're always worried. And what kind of massage therapist are you if you're trying to relax your client, but you're worried
No,
about things?
yeah, that translates through your massage.
Exactly. So here's the first one, the physical. Physical boundaries, for example, might include anything from the setup of your practice, proper draping, understanding a client's preferences, and any contraindications that may exist. The intake process is a great time to have you and your client set up boundaries. For example, I explain to my clients where I will be touching them on their body, and will ask them to let them know if it is part of if there is a part of their body that they do not feel safe or comfortable being touched. So if your client tells you that they prefer to not have their feet touched, do you touch their toes or even through the sheets?
No,
Exactly, unless you say that during the intake to clarify. So you don't like your feet touch. Is it skin on skin? May I try to work on it through the sheets? And if they, okay, then you know through the sheets it's okay. You can't assume things either. I like to have follow-up questions on my intake. And also through the interview process. So something that I have done in my practice, especially after I just graduated, and it's something that my teacher taught us, is to tell them what I normally touch and will point to each part of and touch the part of the body that I'm naming. Okay, so I say, hey, my name is Lyn, I'm your massage therapist. Just to let you know, normally I touch the head, the face, the neck, shoulder, arms and hands, the chest, and I start the glutes, the front and backs of my legs, and the feet. Any of those that I mentioned that you don't feel comfortable me touching. And then they'll state it. And then I say, okay. And sometimes I will, depending on how they tell me, I will ask a follow-up questions like, is it because you're ticklish or something? And if they say, I don't want to talk about it, then there is an emotional attachment to that area.
right.
But if they say I'm ticklish, it's like, okay, would it be okay if I work through the sheets? And then they say, let's try it. There we have it. We just established how can I touch them that they feel comfortable. So that's kind of like what I do with my new people, new clients. So do you have anyone in your practice that has a physical boundary limitation for you?
And you're right. I've experienced individuals with their hands,
Oh,
and
interesting.
it's because, and like you said, you keep speaking. They don't lotion on their hands. They don't want the lotion on their hands. And you're right. That's when I will say, well, what about through the sheets? And I will um, put the sheet over their hand. I go, is that comfortable? Is that okay? If they, and then you got to look at their face and you got to read the signals.
Okay.
And you say, or, you know, that is perfectly fine. We can eliminate the hands today. Am I okay up to the wrist? Well, that's what we'll do. And
Okay.
it's about keeping that client comfortable.
Yeah, most of the people that I've worked with is because they're ticklish.
Hmm.
There's one that thought if you touch their feet, that's dirty. And you don't touch dirty feet because your hands now will be touching the rest of their body. And to them, that's really gross and disgusting.
And I
And
suggest some people to keep, what about keeping your socks on? Especially if they're explaining to me that um, their concern is in their hips and thighs and legs, you know,
mhm.
or in their knee. Yeah, you just got to communicate and speak
Yeah, and
your
some
way
of
through.
them when they say like their knees or their hip, it's because they had surgery there, they were injured there. Most of them will tell me, could we skip the feet or could we skip the knee? It just right now it hurts too much to be touched. Or could we skip my arms? Could we not touch the hair and the face because I'm going out with friends?
Hmm. Hmm.
They don't want to have their makeup ruined. So that's basically it. They have to tell you, and that's great when I have clients like that. I just have to remember what not to touch sometimes.
If it's their feet, I tell them, keep your socks on. That's my way of knowing, you know,
So
it
here's,
works.
here's a physical boundary. The towel or the linen is covering the breast area. So if you're going to massage the chest area, only up to the linen. You do not want to go underneath that linen because that is basically a physical barrier. That's the boundary you cannot go past. So that is what physical boundary is. It's either they tell you what not to touch or whatever, and then there's also the linen that shows you a physical boundary that you can see not to touch. And there's probably some other stuff. It's usually preference. I don't like oil, please use lotion. I don't like lotion, please use cream. I don't like anything on my face. So
Right.
those are physical boundaries. So the second one is, here's another one. The intake form is another physical boundary because they will tell you what they want you to touch or that you can or cannot touch. And they're also health history. Okay, here's the second one is the emotional boundary. So emotional boundaries speak to a therapist's awareness of both themselves and their client. You need to be willing to refer out if you notice a client may need physical support and can't and shouldn't provide. Likewise, you need to know when you are facing emotional challenges that require you to distance yourself from a situation. I have had several experiences with clients post-traumatic stress syndrome, PTSD, right after a car accident. I have often referred them to a counselor. Does anyone have an emotional boundary question? As for you, Gwen, have you had any kind of clients that require some sort of emotional boundary?
Emotional boundaries could also be when that client has recently lost a loved one or someone they really cared about, you
Or a
know,
pet?
or pet. Oh, the
Oh my
pet is
gosh.
huge. The pet
Yes.
is huge. If nothing else, I have learned to ask, what was that pet's name, you know, and so that I can connect with the client while they're in my presence, you know, and
Mhm.
I respect that, you know, because there might be an emotional release and you need to be able to secure that and respect that. And
I've had some clients, well, one in particular that I remember my first year graduated is she did not tell me certain things. So I did my massage regularly and I started working on her neck and shoulder. When I got to her neck, she started crying. I thought I was hurting her because she was crying. So I stopped what I was doing and I said, "Are you okay? Did I hurt you?" And she goes, "No." And she kept crying until I just waited. And sometimes when emotions start flowing during a session, sometimes just being there is enough. You don't have to say anything. And so she said, that was the first time I let someone touch my neck without flinching. Apparently, I did not ask more questions. She just started talking and said, when I was a child, my dad used to hit us on the back of the head. And she didn't feel comfortable with anyone touching her neck, which she didn't tell me that she had a problem. I just went there and then she started crying because she let me work on her neck. And that was the first time. And after she told me this, after a few minutes, I said, "Do you want me to continue?" And she goes, "Yes." And so I continued. I asked for her permission to do that. So
it's
I feel good about that particular situation, how I handled it.
it can be very powerful, very powerful.
Yes, instead of using your hands to heal, you also use your heart and your ears to heal. Wow, powerful stuff. Okay.
Very. Whew, deep breath.
Whew, exactly. I feel so good about being a licensed massage therapist. So
Good
now,
work.
thank you. Here's the professional boundaries. That addresses a vast array of areas. So there's a lot of things in the professional boundary that we can talk about, but we're going to just talk about a few. So proper representation of your abilities is one of them. So you do not want to say, "I can do this, I can do that," when it's not within your scope of practice. You can't say that. So professional boundaries is the proper representation of your abilities, financial propriety, appropriate advertising, as well as observing jurisdictional law and regulations, to name a few. Professional boundaries also include what you consider proper attire, your communication skills, record keeping, hygiene, and cleanliness. So, do you think someone who wears very revealing clothing is observing professional boundaries, Gwen?
Not at all, because then you are giving out mixed signals to our industry, which we really can't afford to have.
Yeah. So does an LMT who market themselves curing ailments being, are they, do you think, are being honest and showing professional boundaries, Gwen?
No, because that is not what we do. We do not cure a person. We may we work to assist them, but we're not the fixers.
Yeah, I mean, we are healers, but the thing is that there's so many different ways to heal. Healing can also mean assisting in the healing process. We are not the one-stop shop in which they just come to us and then, woo, we're healed or they're
No, we're
healed.
not. No, we're not the doctor. We have limitations in our practice.
Heck, even the doctors cannot heal properly because they can
Correct.
just sew them up then and leave them for the post-op. That's our window to help them heal, is the post-op.
Right. And that's where your continual education comes in.
Correct. Now here's social boundaries is the next one. That's the last one that we have for the boundaries, but there's more. Social boundaries generally address issues that are going to produce preclude, sorry, having social relationships with clients. For therapists in small communities, however, where social relationships may exist, being very clear about your professional versus personal role is important. So there's a professional and a personal role. So you have dual relationship. This is where the dual relationship comes in. So if a client asks you to have dinner with them, do you think that's a good idea?
It's not. It's
A
because
gray, yeah, but if there's also a gray area depending on what they're asking, how they're asking, and who is asking.
yeah, who their client is, what the dinner consists of. It's a gray area, and you need more information to make your decision to govern that.
Yeah, I've had a client who had a wife and two kids ask me out to dinner, and I had to say no because I knew where that was going. I had a client who is who became a good friend of mine, and she what happened was I already told her we have a therapist client relationship. That is all we
Okay.
have, and we can also have a friendship, but it's more on the professional side.
Okay.
But there was a time in which she needed to travel and she didn't want to travel alone, so she paid for my trip to just basically drive her around in Denver or in Colorado. She paid for my food, paid for my airfare, she paid for the travel expenses. I was just there to keep her company and drive her to her destination because she didn't want to be alone.
Okay.
And I'm like, okay, no problem.
But you had that understanding.
Correct. Correct. And we had separate beds, separate rooms. Yeah. So that's basically, you have to make that known before it goes further, because once it goes further, it's very difficult to reel it back and say, that's not what I meant. You should have said that a long time ago, because now they thought they understood it. And now you're saying that's not what you meant.
Right. And it's also your job to take care of that person by keeping that
Correct.
information clear.
Yeah. So dual relationship is really a gray area, and there's some things that's absolutely no, no, no. So over 10 years ago, I was advertising on social media, and this girl, here's a story for me. This girl found me on an LGBT site that I ran ads on. She lived almost 1 hour, I think Linwood, 1 hour away from my office in Renton, but she set up a massage appointment. She showed up and I went through my regular intake forms, asked questions, and created a treatment plan. She thanked me and left. A few days later, she messaged me, inviting me to go camping with her and with her 3 dogs. I explained that since she was a client, it will be unethical for me to hang out with her. Um, and apparently she didn't take it well, and that was the end of that client as far as coming in.
You've got to have a clue with individuals, and it's all about how you feel at that moment. And you got to take care of yourself.
Yeah. Okay,
Challenges.
here's transference. This is a big thing in massage, and I know everybody has had an experience of it, one or another. So transference is just a big word. That means a displacement or transfer of feelings, thoughts, and behaviors originally related to a significant person, such as a parent, onto someone else, such as the massage therapist. It is a common a reaction of clients to the therapist. I have a friend who basically have thought of me as a doctor. So when he went to a real doctor, he told the doctor that I had to speak with Lyn first
Oh,
yes, before he made a decision. And I'm going, oh, I'm just a massage therapist. They have a higher degree of education. You should listen to them. Oh my God.
yes.
So that has happened a lot as far as this is concerned. A lot of people come to massage therapy in our clinic because they don't want to go see their chiropractor or they don't want to see their doctor. They see us as their doctor.
Mm-hmm.
Oh, Lyn can fix me. No, I don't
Mm-hmm.
fix people.
We
So,
no, we don't. And matter of in my world, I will tell a person, have you have you seen a doctor? Have you had someone else look at this? I take my instructions from a doctor. That's a direction you might want to go in first and then come back and let me know what they say.
yep, exactly. Or if you don't feel comfortable with the doctor, that particular doctor's opinions or suggestions, then you might want to change doctors and
Mhm.
see, because there are doctors who don't listen to the clients and say, hey, doc, I need a prescription for massage. And they say, oh, you don't need a massage. You need PT. And they send them to PT. They're not listening to what the client needs and want.
Right.
Yeah. So transference occurs when the client makes the professional relationship personal. The client may transfer feelings about a third party onto their therapist. This may happen if a client brings you additional gifts, asks to see you for lunch, requests extra time, or contacts you outside the office. Marianne, here's a story, guys. Marianne had a client or has a client who have made inappropriate comments during the session and has also made inappropriate comments to me outside of work. He was a neighbor in an apartment complex. Without going into details, it started out as hanging out. He would come over to our place and we would cook, and he would send what he's cooked to our place, and we would be drinking, kind of thing. And we would invite some of our close friend who also is a client to this whole party, in a sense, this get together. So it's about food. So this
Okay.
hanging out was basically about food. Then it moved to giving gifts of Marianne's favorite foods, asking her, what do you miss? And then he would look for it and give her those things. Then texting to schedule massage appointments, but written like a poem or love letter. Almost like, my beloved Marianne. It's like, when I read that, I'm going, what the heck?
And we're going down a path.
Whoa. So I told Marianne to talk to the client, when he came to his next visit, and to explain to him that he needs to start calling the office to schedule or reschedule his appointments. The thing is that he still texted her, but Marianne reminded him to call the office. As to make this long story short, I ended up texting him because I did tell Marianne, please make sure he understands. If he understands, he will have to deal with me. So it looked like he didn't understand, so he had to deal with me.
Okay.
I texted this person and I told him, please to call the office. Don't text Marianne. And I reminded him of the inappropriate um, comments and actions that he had in the past. And I strongly recommend to call the office number and, to make cancellations or whatever. So his last, it took about a week. He did call the office to cancel his appointment, and we've never heard from him since.
Lucky you.
I have no idea. I mean, I didn't want to lose him as a client, but I really didn't want him as a client if he's going to try to seduce my wife.
Definitely. My concept of transference, and I keep this in mind, is a breach of trust. And with that
Mhm.
breach of trust, it makes it unsafe for us as massage therapists. So you got to look out for
Exactly.
your safety too.
Yeah. And in the Philippines it's probably a little bit different, but holy cow. If, say, for instance, this guy keeps going to you and the wife finds out it's because of a massage therapist, sometimes the wife will come and bitch you out. I mean, basically face
Yes.
to face,
Hmm.
hair pulling stuff, and who knows. And Some of these folks are not ashamed to scream
No, they're
and
not.
yell.
And it may not have anything to do with you. I have had clients that I am well aware that their wife changed the therapist. You know,
Exactly.
it was just a feeling, and it was, and when I see that client in the office and they're going to one of my co-workers, I say, "Hey, enjoy your session. And how's your wife doing?" You know, you can't, you got to keep it smooth, and you got to understand what it is.
Well, the thing is that it makes everything awkward.
Very.
Yeah, our lives can be easier if only our clients also
Knew
uh,
the rules.
exactly. And it's up to us to tell them the rules. That's the thing. You have to know them to tell them. Here's countertransference. So now instead of the client giving, having feelings for the therapist, it's the therapist possibly having transferal feelings for their clients. It may not be like that, like falling in love with their client, which you're not supposed to be doing. No dating clients, no having sex with clients.
Nope.
But it's also, there's a feeling of, oh my gosh, did I do okay? I feel like I didn't do okay. That kind of feeling of inadequacy if the client is not making progress. It's not your fault if they're not making progress. Okay, so countertransference is just the opposite, where the therapist unloads past issues onto their client. It's also when the client is unable to separate personal feelings from a therapeutic relationship. A massage therapist is supposed to recognize this and keep it out of the client's therapy.
Right.
So the feeling of inadequacy is a big one. I had that in my first couple of years going, oh my gosh, I've been massaging this person for several months and they don't feel like they're getting better. And so I had to ask questions. So are you doing the exercises? Are you drinking enough water? Are you doing this? Are you doing that? And then they would say, no, I thought maybe you can just fix me. And that's where the problem was. They basically said, I am the fixer-upper, and they don't have to do anything. Um,
Yes, a lot of that. And
so
no, we're not.
my response to that one is like, it's great if you have a lot of money because this will be a while, but because insurance is paying for it, I have to show progress.
Right.
Here's another one, experiencing excessive thoughts about the client's problem after the session ends. There are times in which I've had a client in which I'm going, I should have done this better. I should have done this. I should have done that. What if they didn't like it? Um, and then, or their problem is like, oh, how can I fix that? Maybe if I do this next time, it's good to think about it, but if you do that and excessively too much that you lose sleep on it, then that is a problem.
Right.
Playing a helper or a fixer role. You do not fix people. Just to let you know, everybody, you do not fix people. You help, but you do not fix. Thinking you can relieve the client's pain when you are facilitating healing. Pain is a subjective thing. What the client feels might be a lot of pain. But here's the thing, this is where the intake comes in and communication comes in. You say, okay, from 1 to 10, where do you rate your pain? If they say 10, then that's a lot of pain. And then you work with them. And then you say, okay, now where is your pain? 1 to 10. And they say 8. So there's still a lot of pain, but it decreased.
It's coming down.
So it's coming down. So you're just facilitating healing. You're not relieving the pain. You're just making sure that they are able to function with less pain because it is subjective.
It's how they feel, not how you feel about it,
Correct.
what they're experiencing.
So, and then thinking that only you can fix a problem and that you have all the right answers. No, we do not have the right
No.
answers. I refer to physical therapists, I refer to chiropractors, I refer to another massage therapist if I need to, if it's not something that I do. If somebody says, hey, Lynn, can you do hot stones on me? And I said, I don't do that, but Gwen does.
Mm-hmm.
So I'm not afraid to refer people, because if I can help them, so I know somebody can, they might as well get this client.
Yep. If they ask for Thai stretches, I go, oh, you know what? I said, Lynn, it's got that covered. We're going to do this today. I know a couple of good stretches to point you in that direction. And then let's schedule an appointment with Lynn. Yeah,
Yep.
you stay within your range.
Exactly. I'm not afraid to refer, and you shouldn't be afraid to refer. We as massage therapists should help each other. So if you can't do it and you know somebody can, then please refer them to them. Call that person up and say, hey, I've given a client your way. You can, because of confidentiality, you may not share too much. But if you ask permission from the client, say, hey, can I get your name and number to be given to this person so they can call you to set up the appointment? And they say yes, then say, okay, well, I'm referring so-and-so, number is blah, blah, blah.
Right.
So that's how you do that. Not give out phone numbers. I've noticed when I was in the Philippines, somebody's looking for Marianne and they don't know who this person is. Oh yeah, she lives over there. Holy crap, what if that guy is going to kill her? You just told the killer where Marianne lives. Don't do that. I was like, oh my gosh. All right, so now we're going to be showing a video.
Boundaries, how to set them, how to hold them, and how to manage them, especially with the people closest to us, like our children or our employees or our bosses. Well, today we're going to talk about the number one most common obstacle to holding good boundaries. The most common misunderstanding about boundaries is that setting or holding a boundary is mean, harsh, or bad. That by setting a boundary, we have to be mean to someone else. And people who believe this kind of have in the back of their minds this idea that in order to set boundaries, you kind of have to balance out being kind and being mean to someone while still loving them. I mean, no wonder people shy away from holding boundaries, because no one wants to be mean. So let's look into this a little bit more. People often associate saying yes or giving someone something with being kind and loving. And they associate saying no or being firm, direct, or harsh with someone as being unkind or hateful. Well, let's look into this a little bit more closely, because that is not a fair association. We can say yes with love in our hearts, or we can say yes with hate in our hearts. And we can say no with love or hate in our hearts. So let's take a look at this chart. On the top of this chart, we can see two categories, being loving and being hateful or resistant, right? So where is our heart when we're doing a certain action? And is called The Way of Being by the Arbinger Institute. And it's talking about our deeper motivations or our intentions. Are they selfless or selfish? And on the left side of this chart, we're talking about soft or hard behaviors. So what type of behaviors we're talking about. Now, it's easy to think of the soft and loving behaviors, saying things like, yes, I'll listen to you, or yes, I'll give you that toy that I know you've been wanting for a long time, or yes, I'll let you go visit your friend because I trust you and I believe that you're going to be where you say you're going. So that's the soft, loving corner of this chart. The bottom right corner are the hard behaviors with a resistant or hateful heart, right? And these are easy to understand as well. So let's take a look at them. There's screaming, yelling, holding a grudge, any kind of physical violence, right? These are hard behaviors that come from a selfish, angry, or hateful place. Trying to force someone to change, saying no just because you're mad at someone. Right? So these are the two opposite ends of the spectrum, and people often think that's kind of the only way to do it. If we say yes, we're being loving. If we say no, we're being hateful. Well, let's talk about what it looks like if we're saying yes, if we're being soft, having gentle behaviors while holding hate or selfishness in our hearts. What does that look like? This is called soft resistant. So let's think of a parent who doesn't want to deal with their kid anymore. They might say, sure, yeah, go watch TV. I just don't want to deal with you right now, is what they're saying in their heads. Or a parent in the grocery store, they're checking out, there's candy in the aisle, the kid starts screaming or asking for candy. The parent says yes, not because they think it's what's good for the child in this situation, but because they just don't want to hear the kid screaming. They're uncomfortable with the way other people look at them. They, for their own discomfort, are saying yes to the child. That's considered soft resistant. Right? So giving in a selfish way. Here's another example. Think of two people who are dating, and the one says, I love you, and the other one says, I love you too, but they don't really mean it. They're actually planning on breaking up with that person, but they don't want to, have to have an awkward conversation or an uncomfortable conversation, so they just kind of avoid it. Maybe they'll break up with the person through text message or just stop talking to them altogether. Now, this isn't because they're trying to be kind or loving to that other person. It's because they don't want to feel that discomfort. So to protect themselves, they're just being all soft and sweet, but in their heart, in their mind, they know they don't want to be with this person anymore. Now, it's not hateful to break up with someone, but it is selfish to not be upfront with them, to protect yourself from feeling that discomfort. A couple more examples, like being passive-aggressive or sucking up to a teacher. You're treating them really nicely to get something from them. These are all examples of being soft resistant. Now, let's go to the other corner of this box. How is it possible to be hard with your behavior while still being loving? I'm going to ask you right now, is it possible to go shove a little kid right into the road and he gets all scraped up, hit him hard maybe, right? Could that ever be a loving behavior? Well, yes, if a car is coming, right? If a car is coming to hit this kid and you push them out of the way of the car and they get skinned knees, that's the most loving thing you can do for them in that moment. Now, I'm obviously not advocating physical violence, but I'm saying that almost all behaviors can be done from two different places, from a loving, selfless place or a hateful, selfish place. So, saying no more TV. Yes, you must brush your teeth. No, you can't buy that toy right now. These are all ways to lovingly help provide a positive future and discipline for a child if they're coming from a place of love. I once had this boss, his name was Shane Gallagher, he was amazing, and he told me a story about a time when he fired someone with so much love and concern for their future that they thanked him afterward and said, I just really appreciate you looking out for me by firing me, right? He fired someone out of love for them. And it was because, the job just wasn't the right place for them to be. They weren't able to do a good job for the other people there. They needed to be somewhere else. So, this is the hard, loving side of things. I hope that by taking a look at this chart, we're able to let go of this false idea that saying no is just this mean thing we have to do and balance out with, being nice. Saying no can be one of the kindest, most loving things we do for someone. People respond more to our intentions than whether we're saying yes or no. Working in residential treatment, I've seen two different staff tell one child in treatment the same rule. You have to XYZ. And the other staff saying, you have to XYZ. And the child says yes to the one and no to the other because the child can tell where is that staff member's heart in the time they're telling them that rule. So it's less about rules than it is about where your heart is when you're enforcing them and setting those boundaries. People will feel when you're saying no to them, they can feel that you care about them when you do it. Some people might get confused by this, thinking that what I'm saying is we should let people walk all over us, or we should allow people to take advantage of us, or we should never really, do anything harsh to someone else. And that's absolutely not what I'm saying. If someone's mistreating you, is it really in their best interest that you don't put your foot down? No. In general, the reason people don't set boundaries is because they're afraid of being mean, they're afraid of feeling guilty, or they're afraid of feeling scared. So the reason they're not setting that boundary is not for the other person. They're not trying to be kind to the other person. They're trying to prevent themselves from feeling uncomfortable. It's selfish. Setting boundaries with someone else or telling them no can be the kindest thing we do for them and the most honest thing we do for ourselves But to do it, we have to allow ourselves to experience our emotions. Now, remember, the way we get healthier is not just about feeling better, but it's about getting better at feeling. So we allow ourselves to feel a little bit of discomfort as we set these boundaries, and we're going to get a lot better at it. So just to sum things up, let's let go of the idea that setting boundaries is mean and focus instead on where our heart is when we're making these choices about boundaries, right? Let's focus our intentions on being kind, loving, and seeing what the other person needs. I hope this was helpful, and thanks for watching.
So yeah, that's a lot of misconception that when you say no to somebody, you're being mean, you're being negative. I've seen that a lot when I say no to people. When I was in the Philippines, it's like, you're always nega, which is negative. So, so it's like, but I said, no, you're asking me a question. I answered with a no. You were hoping for a yes, but I said no, and I mean no. And that's the thing. I come from a culture, I grew up in a culture that basically you say what you mean. You don't say what you don't mean, hoping that they'll leave you alone. So when you ask a question, if you don't like the answer, then I'm sorry, that's me. I don't mean to be mean, but if you do keep asking the same question after I just said no, then you deserve what I tell you. That's me.
And if you say no, you got to stick with what you say. You have
Yeah,
to follow up and be firm, because that's your time, your energy. You've got things to do other than them.
yeah, well, yeah. And the thing is that I can also understand on their side of things that they're excited, they want to do this. But what I don't understand sometimes is they don't see how taxing it is for me or whoever that they're asking this question. I see some people as a little bit on the selfish end. And I have to, because I'm OCD with answering questions,
Yes.
I have to answer all the questions now. Oops, that hurt my throat. So I end up giving too much of my time, and then they see, oh, Lyn has a lot of time, when actually I don't. And so now I'm learning how to not answer certain questions, because I don't have the time to be there texting somebody.
Right.
But
And
I
in a
will answer as much as I can.
and in a business standpoint, you can always say, well, it's my policy, and stick with that.
Yeah, I could do that. Yeah, definitely. Very easy to not understand boundaries because you don't want to hurt people's feelings, or you don't want to look like you're mean. And unfortunately, it's not about meanness. It's about what you are able to give them and not give more than what you can. And that's another thing. As healers, as massage therapists, we do not want to overtax or overburden ourselves with too many people. And I've seen so many massage therapists doing more massages in a day than what they can physically do. So that's great if you can do it, but are you really giving all your clients 100%?
No. And then you
Exactly.
burn out.
Exactly. I've been doing this for 22 years. So I know my limits. I can do 5 hours, maybe 6 hours a day, but that doesn't mean I do it every day. That's the secret. So we're talking about boundary troubles. This is where you can get in trouble with boundaries. So many boundary problems can be traced back to 4 situational responses styles. So it's important to be aware that these styles can be projected by either the massage therapist or the client. Compliance. This reaction most commonly comes from a fear of hurting someone's feelings, making someone angry, or feeling guilty. So compliance, like, okay, sure, but you really don't mean it. You just want to go with the flow and see where it goes. But then when you say, okay, sure, the other person says, okay, let's keep doing this because it's okay. Or they'll do it before asking you and you end up going, but I didn't want it today. Or you can be back to compliance as, okay. And then that's it. They've taken up your time. They've taken up everything. And you can get in trouble for that one. So compliance, if you don't feel comfortable, say it. I don't feel comfortable. Maybe next time. Easy as that, but nobody wants to hurt feelings, other people's feelings. Avoidance. People who have trouble recognizing their own needs or avoid letting others help. So these are the folks that just avoid everything. It's like, oh, there's that person, rather than talking to them. Oh, I gotta go. I'm busy.
Mm-hmm.
Or ghosting. You don't even want to talk to them. You don't even want them to see you. Did they see me? No? Okay.
Yeah, you duck in the room, turn around.
Exactly. Put a hat on, and then sneak out. Those are avoidance. But what kind of a business are you running if you're avoiding your clients? That's not a business.
That's not a business.
So the controllers, these are the aggressive bullies or manipulators. Controllers manipulate or motivate others and project responsibility for their lives onto others. They lack respect for the boundaries of others and often see someone saying no as a challenge to change their mind. So the controller ones, when you say no, it's almost like, oh, well, I can make you do that. Watch me. It's like, I just said no.
Or
What does
they
no means to you? Maybe?
say
No.
fine.
No.
Yeah, fine. I'll get someone else to do it,
Yeah, but
Try to
see,
make you feel
controllers.
guilty.
Yeah, but controllers, it's like it's a challenge. They're going to do it anyway, regardless of what you say. They're the bullies. They're the manipulators. So, like, say, I ask you to do this as I'm the therapist. You, Gwen, is my client. Say, hey, Gwen, next time, is there any way that this can happen before the session? Like if you smoke, I've told some smokers that, hey, would it be okay if you don't smoke right before your appointments because I'm allergic. I don't like the smell. And to them, it would be a challenge. Well, fine, I'll smoke, or something like that. They'll even do it more than less.
Right, just to see if you're true about reacting to it or being
Yeah.
allergic.
And then they'll say, oh, you can take it. It's not, I didn't smoke that much. That's the controller making me feel like my feeling, what I said means nothing.
Right.
And then unfortunately, I'm not the compliant person. I'll say, well, in that case, then you might want to see another massage therapist. Ooh. Ooh. So, and the other one is the non-responsives. So these non-responsives fail to recognize there are boundaries at all. They have a critical attitude toward the needs of others, and sometimes they are just so absorbed in their own desire and needs, they fail to acknowledge those of the people around them. So the non-responsive, almost like I picture somebody doing a book and just basically say, yeah, whatever. Or they don't even respond. Yeah, whatever. So like, say for instance, you're massaging a client. The client caresses your leg. You don't do anything about it. You don't see that there is a boundary problem at all. That's the non-responsive.
Right.
When you're non-responding to something that's happening to the person doing it, they think it's okay. They keep doing it until you respond. Either, yes, keep going, or will you stop that?
For the ones who want an appointment on a certain day, but you're not available that day or that time. And then they're talking to you as if you should make yourself available that day.
Oh my gosh, that's the controller. That's the controller. I've had a client that I had to let go because I was with another client when he called the office. The receptionist answered and says, Lyn is with another client. And he goes, could you just have her get to the phone? Like I had to stop my client, my session with my client to just talk to him. And she goes, no, she's with a client. She'll call you after the whatever, you know, the session. And he was basically screaming at my receptionist. And finally, when I finished that client and I went to the receptionist and goes, so-and-so called and they were, you know, I don't feel comfortable talking to him. He wants to talk to you and he was screaming that he wanted to talk to you while you were with a client. And so I asked what was said and then I called him back and this is my response. This is how I deal with controllers. It's like, hi, this is Lyn Century Massage. I hear that you called and you wanted to talk to me. What is it about? And so I'll listen to him and he'll say something as, oh, I'm sorry, but at this time, I am not going to be available to be your massage therapist. And then he'll ask why. He goes, well, here are the things that happen. And here are the things that I don't want to have happen again. And then they'll say, oh, it won't happen again. You're right. It won't happen again because you'll be seeing another massage therapist.
Mm-hmm. Yep, you have
And
to.
that's it. They see another massage therapist. They're not seeing me again. Yes, I lost a client. But here's the thing. At least I kept my dignity and I kept my receptionist, because if he kept going, I would have lost my receptionist. I would have lost my business because he would take over and make my other massage clients feel like this is not a relaxing place. This guy can take over.
Right. Which means you just totally lost the boundaries.
Exactly. And so I am not afraid to tell boundaries. Unfortunately, there's a lot of people who are not comfortable with that because, again, just like the video, boundaries is very difficult to talk about and to put in place when you are in the middle of a pandemic saying, I need the cash. But if somebody is going to masturbate in front of you and say, hey, can you do a happy ending? I'll give you $100 for it. Would you do it? No, that is not within my scope of practice. That is prostituting myself. I will ask that person to get the hell out of my office before I call the police.
Because losing your boundaries at this point in time is not going to secure you when things change. And things are going to change. But your boundaries need to stay in place at all times.
Well, this is also when your character comes out.
Yes.
Who are you? What do you believe in? What do you hold dear? I hold my health really sacred. I want to be as healthy as possible, mentally, physically, spiritually, and all that stuff. I do need to lose a couple of pounds because I like food, but I can do things. I'm still pretty healthy overall from my last physical. So I don't want anybody telling me what to do. And if they're going to tell me what to do and they have a point, I will listen. But if they don't have a point because they're trying to control me, then that's the end of the game. You don't get to play anymore because I'm going to end the game.
Right. You're the therapist. That's where your control comes in.
Exactly. And vice versa. As massage therapists, you do not want to control your clients. They will leave you. They will feel that you are not their parents. You cannot be doing anything like that. So moving on to the next one, big thing, do not have sex with your
Do not.
clients.
No, no,
Not
no.
engage. That's a big no-no. A massage therapist should not engage in a sexual relationship with a client while under their care. If there is mutual agreement to pursue a sexual relationship, there must be a minimum of 6 months. In the state of Washington, I read 2 years. after you have terminated the client-therapist relationship. So you cannot be seen by this person and pay you for massage for at least 6 months. And then you can pursue a sexual a relationship with that person, be it sexual or not. But that means in that 6 months, nothing is happening. That's what it means. You terminate the client-therapist relationship and you stay away from each other.
Away.
If you really feel that close to them and they feel the same way about you, then after 6 months, see where it goes. But until then, you cannot have any type of relationship after you terminate that client therapist relationship. That'll show you if what you guys are feeling is really true, or is it because there's a power dynamic during the session. Now,
Right.
here's another thing. If you do not terminate the client-therapist relationship, what does it look like when you're having sex with that client and then they come in for a massage and they pay you? Isn't that very closely related to prostitution?
Yeah, you are crossing a very dangerous
That
line
is prostitution.
all day.
So do not have sex with your clients. And if there is feelings between the two of you, please wait. See if it actually works out after. 6 months is the shortest time frame that they've allowed here in the state of Washington. They're even saying 2 years because of that power dynamic. That client may feel that transference, and really it was about the massage that they felt, oh, I remember when so-and-so that I was really in love with gave me massages and it felt like that. And they kind of thought you were that person, but you're not that person. And then find out, oh, you're not the person that I thought. It was only that 1 hour time frame.
Right.
So
They changed
yeah.
their mind and you're stuck.
And in the state of Washington, you can lose your license if you actually lose that boundary and then you started touching them during a session. They can report you and you can lose your license here in the state of Washington. So, that's the thing. Now, if you already have a sexual relationship with that person and pay for the massage, as I was saying, that this is a dual relationship, and this is a violation of ethical standards. You do not have relationship with a client, have sexual relationship, and get paid for massages. Now, if you're married to one, I'm married to one, we don't necessarily pay each other. We just trade. And plus, nothing happens on the table. We already have a relationship. And when we trade massages, it's really just trading massages. The table there's nothing sexual happening. There's no eroticism or whatever associated with that table. It is medical, clinical, and professional.
Right.
So this is why we call it a table and not a bed. At least that's how I view it.
That's one of the first things I had to learn in massage school. That was
Yeah.
probably the first thing I learned.
Yeah, get on the bed. No, that's a
No.
table. You must also refrain from sexual activity with coworkers, employees, trainees, or any other professional in your workplace, in addition to the clients, because that can make your workplace a hazard, awkward, and definitely not safe for you after a while, especially when there's a power dynamic as well going on with your boss and there's you or a coworker or blah, blah, blah. You just don't want to be in that situation. So nearing the end of our talk here, our seminar, here are some other concerns that we did not necessarily touch on, but something that everybody should also look into. And this is just some, there's probably more that we haven't thought of. Proper draping. That's part of the physical boundary that we talked about. So in order for you to massage an area, you do not want to go underneath the draping, especially near private areas, the breast, the midsection, the genitals, and all that stuff. Client's personal concerns. So now you also have to hear what the clients want done, what kind of result they're looking for. You as a massage therapist need to ask more questions other than read what they put on the intake form. You have to be a part of their healing process by asking some questions like, well, okay, these are your concerns. Why is it, how did it happen? Blah, blah, blah. If they were injured, how did you injure yourself? What do you do when that starts hurting? You know,
How long has it been, have you been in this, distress or feeling this body part,
correct. Or what have you been doing to relieve that
relieve
pain?
it? Right.
So if something works that they're doing, then you're going to have to say, oh, I can incorporate that in my session. Stretching.
Or yeah, what aggravates it?
Oh, that too. If it aggravates it, then you don't want to do that particular movement or activity. So receiving gifts or benefits from clients, that could be a transference right there, and also moving into dual relationships. Not that I'm saying that dual relationship is a bad thing, but it can lead to bad things. You just
It,
have to see who that person is wanting to a relationship. We have friends now who are clients, or clients that became friends. I mean, good friends, close friends. So close that, we call each other up and, hey, let's get together. But you don't do that to everybody. You
right.
just can't do that to everybody. That's too much. And receiving gifts, can be okay. Gwen, you and I were rehearsing yesterday. Let's say, for instance, it is every month this person gives you a gift.
That's too much.
That's
You
too
got to,
much.
you got to know what you got to know what the intentions
Or
behind
you
that.
might want to ask what the intent is, because it's like, wait, you're giving me a necklace. That usually means something. I don't want, and I would probably say, I'm sorry, I can't accept that gift. It's inappropriate.
Right. At some
Because
point in time,
it's
you
not
have to
something that,
control that.
yeah, it's not something that the clients give gifts of necklaces to their therapist. You don't. I can see monetary as tip, but now if they give you more than the usual, then it's like, what was this for? You
Mm-hmm.
have to ask.
Mm-hmm.
But here's the thing. Now it's November and they gave you a $100 tip. Is that questionable or not? I had a client who gave me $100 tip. He never tips before though, but it was the holidays. He gave me $100.
And I've had similar. It was the holidays, and if you inquire, when I inquired, because it was such a generous gesture, and the response was, it's the holidays, and I don't tip throughout the year.
Okay. Yep.
This is the
Exactly.
one day I made that preparation,
Exactly.
but
Yep.
it was communicated.
Yes. Again, communication, setting up boundaries. If you feel uncomfortable with the gift, you need to tell that person, do not avoid, do not just be compliant, take it. It's like, what is this for? And who knows, they may thought it was a $10 tip and they
Right,
gave you 100.
right.
Is this correct? You gave me 100? Oh, thank you. Is this for the holidays? Oh, thank you.
I
So make it clear
make
to
it
yourself.
clear.
Practicing beyond the scope of practice. I know of a lot of massage therapists in the Philippines. They have a massage license and yet they are practicing chiropractic.
Oh,
Um,
okay.
there's no, how do you call it? I don't think there's anyone actually looking into this. And I've also seen people practicing acupuncture. It's just that here in the state of Washington, that is two totally separate licensing. Acupuncture has a different licensing parameter. Chiropractor, that it's 2 or 4 years of schooling for us here, and you just can't crack joints just because you can. And so on and so forth. You just don't do it that way. So I don't know about in the Philippines, but I would highly recommend that LMTs put themselves in a higher scope of, standard, a higher standard, and just be better at the massage, because that's where your license is. If you have a license or there's a requirement for acupuncture or what they call bone setting, then go get that. A certificate, just learning it from somebody, is not enough. It takes 2 to 4 years here in the States. So a few hours is, you're not a bone setter. You can't
No.
be. You have to know anatomy and physiology. You have to know if you're going to crack their neck and paralyze them or not. That's a huge thing. So, yeah, practicing beyond your scope of practice is another thing that could be talked about with ethics. Inappropriate advertising, like saying I do acupuncture. That's inappropriate as a massage therapist, at least as far as I know. Or inappropriate advertising saying I'm better than another person. Come to me because I'm better than these folks. That's inappropriate advertising. What kind of advertising is that when you're comparing yourself to another? That's kind of low.
Oh, wow. You get a lot of comments on that.
Exactly. Misleading claims of curative abilities. I've seen that a lot on posts of other massage therapists saying that, come to me and I will rid you of your toxins. That is not true.
No,
Massage does not get rid of toxins. Massage aids in getting rid of toxins, but our body without massage can get rid of toxins by itself. The skin, liver, kidneys, digestive system, everything is trying to have homeostasis. We don't need massage to get rid of them. Water, thinking water, just helping process everything. I don't even say it flushes toxins either, drinking water. I just make sure that everybody stays hydrated, because if you're not hydrated, you're still gonna feel stiff.
right.
So I don't even say that. I used to say that, not anymore, because they found out it doesn't flush toxins. They never saw anything that proved that. So misleading claims of curative abilities, when somebody says that, I question their integrity. If you help a lot of people, guess what? You don't have to advertise. Your people, your clients will advertise for you.
They will. They definitely will. Just be better at your work and what you do, and it speaks for itself.
Your work will speak for itself. So you don't necessarily need to advertise and saying you've cured people. If they feel that they've cured, let them talk. Don't let yourself say that, because they are your testimonials. Misrepresentation of educational status. Basically stating I've learned from Harvard and I never went to Harvard. I can't say that. I can't misrepresent myself as being educated at someplace when I wasn't there. Documentation and records. A lot of people, hopefully in the Philippines, as a licensed massage therapist, are documenting and getting records. The intake form and what you did on that day, what you worked, what was the result, so that the next time they come in and goes, oh, okay, how do you feel? We worked on your shoulder before. And then they say, well, it's not my foot. Oh, your shoulder is okay then? Yep, now my foot. Okay, so we'll work on the foot. And then you record them that you worked on the foot.
Right.
And the next time they see, okay, how's your foot? No, not this, you don't know what you did, because how can you help somebody if you don't know what you're doing?
Right.
You have to record what you're doing because you know which one works, and so you do it again.
Right. And especially in times of the pandemic, when there may be months that you don't see a client and it's no fault of yours or the client. That is just what the current health situation is. And then they come back,
Yeah,
you need that documentation to see 3 months ago, 4 months ago, this is what we
exactly.
worked on. How are you now? How is,
And another thing, as licensed massage therapists, at least in the state of Washington, we have a license that is medical. We can try to get paid by insurances.
Mhm.
That's how much our license means to us. We can go to insurance to get paid. If the massage therapy industry in the Philippines want to get to that point, you need to work as a whole and maybe create something that can get you there and have it head by somebody who actually is ethical and have integrity and have character and who will fight for the LMTs in the Philippines. Unfortunately, sometimes you can start that way and then they have power and they get bought. And so, and it's just very, very sad to hear. But there are a lot of people who really want the massage therapy industry in the Philippines to change. It's just that it's like a David and Goliath thing. It's already so big as far as cancer of corruption that's hard to correct everything when it's a systemic corruption. So that means you have to erase everything, start all over. And that is a huge undertaking. Hopefully it can get there because I really want the LMTs in the Philippines to succeed. Because if they succeed, then our plans of open up a clinic in the Philippines will succeed. So if there is anybody, use the chat button. Unfortunately, we've gone 2 hours now and I have to pick up my wife. I left her at a friend's house just to be here on time. So hopefully, if you guys have any questions, just feel free to type in the questions on the post on Facebook, the group Advancing Clinical Massage Therapy in the Philippines. So I want to thank you, Gwen, for joining me and making this event a little bit more worthwhile, talking to somebody else and asking for their opinions and stories than just talking about myself. I feel like it's much better when you talk to somebody else.
Always. And
Huh.
I love the subject. I love speaking on this particular subject.
So next month, Gwen, will you join us to go through the table tie sports massage?
Of course, that is fun stuff.
All right. Did you receive my invitation?
I did.
Okay, so it's all set. Everybody, next month, I don't have the exact date, but it is, I think it's October 25th or 29th, somewhere in the 20s. We'll have the table tie sports massage. I've already put together the video. I just have to put together the presentation. So, all right, Gwen and everybody, good night here in Renton. And I guess it's good afternoon in the Philippines. Thank you all. I'll be editing this whole thing so it's a little bit shorter and
Okay.
I'll post it again so everybody can see. All right, thank you,
Perfect.
Gwen.
Thank you. Good night or
Good
good
night
day,
and
afternoon.
good afternoon. Salamat.